name is Adam Cuker. I am a hematologist at the University of Pennsylvania in Philadelphia, and it is a real honor to speak with you today about ITP and fatigue. These are the questions that I will set out to address during my presentation. First, what is fatigue? Second, how is fatigue measured? Third, how common is fatigue in patients with ITP? Fourth, what is the mechanism of fatigue in ITP? And finally, how can fatigue be treated? So let's begin with what is fatigue? Well, fatigue is a fairly common word in colloquial English, and the colloquial definition, according to the Oxford English Dictionary, is a feeling of being extremely tired, usually because of hard work or exercise. Now, the medical definition of fatigue is a little bit different. And this is what that definition looks like. And this is the definition that I'll be using during my presentation. Medical fatigue is a condition marked by extreme tiredness and inability to function due to lack of energy. It is usually experienced in the absence of any excessive expenditure of energy as a cause. So you'll notice that compared with the colloquial definition, we've added two new elements here. That medical fatigue is fatigue that results in an inability to function. It interferes with daily life. And secondly, that it's unexplained. It can't be, we're not talking about feeling very fatigued after running a marathon. This is fatigue that occurs in the absence of any excessive expenditure of energy. And so please keep this definition in mind as we proceed. So second, how is fatigue measured? Well, it turns out that fatigue is much harder to measure and quantify than a platelet count. In clinical practice, perhaps because fatigue is hard to measure and perhaps because the importance of fatigue in ITP is probably underappreciated, fatigue is usually assessed only informally or not at all. If you think back to all of your visits with your doctor, think about, has the doctor asked you specifically about fatigue? And is it more of just a yes or no question, or has the doctor probed about symptoms that you might have related to fatigue? Well, in research studies, fatigue is usually measured with a validated questionnaire. And there are a number of such questionnaires available. One is called the FACIT fatigue scale, and you see version 4 of that scale right here. And these are the sorts of typical questions that we see in these type of questionnaires. You might answer, I feel fatigued, I feel weak all over, I feel listless or washed out, I feel tired, I have trouble starting things because I am tired, I have trouble finishing things because I am tired, I have energy, I am able to do my usual activities, I need to sleep during the day, I am too tired to eat, I need help doing my usual activities, I am frustrated by being too tired to do the things I want to do, and I have to limit my social activity because I am tired. And so we can use scoring systems and scales like this to really quantify fatigue and determine whether an individual has fatigue that's more than what we find in the normal healthy population. Okay, so let's move on to our third question. Just how common is fatigue in patients with ITP? Well, the short answer is very common, much more common than it is in the general population. The first study to put fatigue on the map in ITP was a survey study that was performed in the UK and the US a number of years ago. And the authors used a validated fatigue questionnaire, much like the one I just showed you. And according to that questionnaire, 39% of ITP patients in the UK and 22% of ITP patients in the US had significant fatigue. And this was compared with only 2.5% in healthy controls. Now, lest you think that this is just a cultural phenomenon, there have been studies around the world showing similar findings. In a study of ITP patients in Belgium, Austria, and Switzerland, 43% reported fatigue at the time of their diagnosis of ITP. In a study in India, 59% of patients reported fatigue. In Japan, 45% reported fatigue. Now, most of these survey studies involved adults with ITP, but this phenomenon does not appear to be specific to adults. For example, there was a recent study of children with ITP in Canada and the US, and 54% of children and 62% of adolescents with ITP reported moderate or severe fatigue. So these are incredibly high numbers and suggest that fatigue is a very common symptom in ITP. We do need to take these numbers with a touch of salt, though, because remember that these are survey studies and not everybody responds to a survey. There's a selection bias to who responds, or response bias, and it may be more likely that people who suffer from ITP-related fatigue will be inclined to participate in a survey study related to fatigue. So it's possible that these numbers could be somewhat inflated, but nonetheless, a substantial fraction of patients with ITP suffer from fatigue. And so you might be wondering, well, how common is fatigue relative to other ITP symptoms? And we get our answer to this question from the recently completed ITP World Impact Survey, or I-WISH survey. This was a survey of more than 1,500 patients with ITP from 13 countries around the world. And the key findings were that 50% of respondents reported fatigue, and 65% of those individuals reported their fatigue as severe. And if you take a look at this figure on the right side of the screen, it shows you how fatigue stacks up against other ITP symptoms. On the y-axis here, we have the percentage of patients who reported a given sign or symptom. And what you'll see is that the leader of the pack is fatigue. So again, 50% of the respondents reported fatigue as a symptom. That was the most common symptom, more common than anxiety around an unstable platelet count, more common than bruising or petechiae, the most common symptom. And on the x-axis is the percentage of patients who report a particular sign or symptom as severe. And again, of those 50% of patients who reported fatigue, 65% of them reported it as severe. And so this is not only a common symptom among patients with ITP, but it's one that carries a heavy burden for the patient population. So why do patients with ITP have such high rates of fatigue? What is the mechanism? Well, I think that's really the million-dollar question, and I don't pretend to have a definitive answer for you, but I'll do my best to shed some light on this very interesting question. So when we in medicine are wondering about the mechanism of a disease or a symptom, one of the first things that we like to do is epidemiologic studies to look for risk factors or associations. In other words, are there certain characteristics of patients with ITP and fatigue where those characteristics are more common in those who have fatigue than those who don't? And so here are some risk factors that have been identified. Bleeding severity. ITP patients with more severe bleeding are more likely to have fatigue. Some studies suggest that a lower platelet count is associated with fatigue, but I have to tell you that the evidence is conflicting there. There are other studies that show no relationship between the platelet count and level of fatigue. Not surprisingly, sleep quality is associated with fatigue. Patients who report poor sleep are more likely to suffer from fatigue. Also, not surprisingly, depression is an association. Patients who have been diagnosed with depression are more likely to report fatigue. Treatment with corticosteroids is associated with an increased incidence of fatigue. And we could speculate on reasons for this, but certainly one possible explanation is that, as many of you are aware, a common side effect of corticosteroids is insomnia and sleep disturbance. And certainly many nights in a row of poor sleep are going to contribute to fatigue. And then some comorbid illnesses that are common in patients with ITP, such as hypothyroidism, are also associated with an increased incidence of fatigue. Now, one of the potential contributors to the mechanism of fatigue is something called sickness behavior. This may be a term with which you are unfamiliar, so I want to explain what we mean when we say sickness behavior. This is a little girl who is sick. You can see she's been sweating. She has a thermometer in her mouth. If we had to guess, not knowing anything about her, she probably has some kind of a viral infection and she feels crummy. And we have all felt this way before at some time or another in our lives. And we all know that when we feel this way, where do we want to go? Our very first instinct is to go to bed. And this behavior of going to bed when you feel lousy is called sickness behavior. And we think that it probably has an adaptive function. When we go to bed, we are conserving our body's energy to fight off this infection, this illness, so that we are not expending the energy on our usual activities during a day. And so this sickness behavior is thought to be mediated by inflammation and specifically by chemicals in our body called pro-inflammatory cytokines. So when we get sick, when our bodies are inflamed, these levels of cytokines ramp up and they prompt us to get into bed and rest so that we can get better. So here is an example of a clinical scenario where this process seems highly adaptive. Imagine this a patient with an acute infection, perhaps like the little girl that we saw in the last slide, maybe an acute infection due to influenza or COVID-19. So we have this inflammation in our body, these pro-inflammatory cytokines. They induce us to get into bed. We rest for a few days, and our body is allowed to use its energy to bring us to a state of recovery. This is the way it's supposed to work. But there are other contexts in which inflammation occurs, and those include chronic autoimmune disorders like ITP. And so in an autoimmune disorder like ITP, the body is inflamed. These pro-inflammatory cytokines are at increased levels, and they may give us the same sort of feelings, the desire to get into bed, make us feel tired. But the problem is that unlike influenza, a virus from which we typically recover, these are chronic conditions. And so this leads to a state of chronic fatigue. And as you might expect with a theory like this, ITP is by no means the only autoimmune disorder associated with fatigue. 80 to 93% of patients with rheumatoid arthritis report fatigue. 50 to 92% of patients with lupus report fatigue. So fatigue is a very common symptom in patients with a multiplicity of autoimmune disorders. So I think it's unlikely that there is a single mechanism that explains fatigue in patients with ITP. And so I think of fatigue as being most likely multifactorial, with many contributors potentially leading to fatigue. What are those contributors? Well, I've mentioned some of them already. This idea of inflammation and sickness behavior driving up those pro-inflammatory cytokines and making us want to get into bed and not do anything. Comorbidities that are common in patients with ITP, and one classical example is hypothyroidism. Fatigue is a characteristic symptom of an underactive thyroid. Patients with ITP, of course, may have increased bleeding, resulting in anemia or iron deficiency. And fatigue is a symptom of both iron deficiency and anemia. Patients with ITP may have sleep disturbances. Medications like steroids may contribute to those sleep disturbances. Patients with ITP may have psychosocial stressors because of their condition. They may prompt stressors with relationships, with their job, with their schooling, all of which can contribute to poor night's sleep and fatigue. And so you'll see that many of these different causes can feed into each other. For example, we talked about steroids, a medication that may lead to a sleep disturbance and contribute to fatigue, or psychosocial stressors, which may lead to a disturbance in sleep and contribute to fatigue. And then finally, some patients with ITP may suffer from depression, which certainly can result in decreased energy as well as a poor night's sleep. And some patients with ITP, particularly those with very low platelet counts, may be advised to have restricted activity. And patients who have activity restrictions, who are not getting a lot of physical activity, may end up feeling more fatigued as a result. And so I think that there are many different contributors to fatigue in patients with ITP, and it's likely that different patients will have a different profile of factors contributing to their fatigue. So finally, how can fatigue be treated? Well, before we talk about specific treatments for fatigue, I think it's worth noting that ITP patients are highly motivated to seek treatment for fatigue. This is a major treatment priority. And we know this once again from information from the I Wish survey, where patients were asked to select and rank their top 3 treatment goals and their most important treatment goal, their main goal. And you can see right here that increasing my energy levels was the 3rd highest treatment goal among patients with ITP. 41% of patients listed this in their top 3. Healthy blood counts and preventing episodes of worsening of my ITP were the only treatment goals that ranked higher than increasing my energy levels. And when we asked respondents what was their number 1 goal, their main goal, 20% reported increasing their energy levels. That was second only to having healthy blood counts. So improving energy levels, reducing fatigue is a major treatment priority for patients with ITP. So how would we go about doing that? Well, I think a lot of it has to do with the particular mechanism or mechanisms at fatigue that may be at play in an individual patient. For example, if one of the major mechanisms is a comorbidity like hypothyroidism, well, then it's critically important to treat the comorbidities to improve fatigue. If one of the mechanisms is iron deficiency with or without anemia due to blood loss, we should treat the patient with iron supplementation. And they may need stepped up treatment of their ITP or other sorts of treatments to reduce bleeding symptoms. If medications such as corticosteroids are contributing to fatigue, then we should seek to minimize corticosteroid use and look for steroid-sparing alternatives if needed, and preferably ones that don't disturb a patient's sleep or reduce their energy. If sleep disturbance is a problem, we should be encouraging our patients to exercise good sleep hygiene. This means waking up and going to bed at about the same time every day. This means minimizing caffeine. This means not doing heavy physical activity shortly before going to bed. And some patients may have sleep disturbances that are profound enough that they require a sleep aid, a medication to help them with sleeping. And one such medication that a number of my patients have used with success is melatonin. If psychosocial stressors and or depression are contributing to the patient's fatigue, there are a number of treatment options: counseling, cognitive behavioral therapy, yoga, relaxation techniques, and again, if the patient has clinical depression, antidepressants. If activity restriction is contributing to the patient's fatigue, then we should think about stepping up the ITP treatment if we can, to try to raise platelet counts into a range so that the patient is able to participate in their desired physical activities. And of course, almost at any platelet count, we ought to be able to identify safe physical activities that a patient can participate in so that they remain physically active. And finally, this last mechanism of inflammation or sickness behavior, I think this is the one where we have the least idea about how best to manage. Would immunosuppression or anti-inflammatory agents help? Well, it's appealing to think that they might, right? If this is a process that's driven by inflammation and by pro-inflammatory cytokines, then perhaps by giving medications that counteract that process, we can improve upon this sickness behavior and desire to get into bed that patients have. Now, a key question that I've been asked many times is, does raising the platelet count all by itself improve fatigue in patients with ITP? And I would say, by and large, evidence is conflicting on this matter. Some studies, as I mentioned before, identified low platelet count as a risk factor for fatigue, and some did not. Some studies showed that treatment with various ITP therapies reduced fatigue, but some seem to show that treatment didn't have any effect on patients' fatigue. In my clinical experience, some patients do feel more energy when their platelet count is higher, but for other patients, the platelet count doesn't seem to matter. The patient's energy level doesn't seem to track with their platelet count. And my thinking is that whether a patient experiences improvement in fatigue with treatment of their ITP probably depends in large part on the mechanisms of fatigue that are at play in that particular patient. So if we go back to our table of mechanisms and their various treatments, some of these mechanisms probably can be addressed by improving platelet counts and treating the ITP. For example, if a major mechanism of fatigue operating in the patient is iron deficiency and anemia, then the patient may truly benefit from ITP therapy to improve their platelet count, reduce blood loss so that they don't suffer from anemia and iron deficiency. Similarly, if activity restriction due to low platelet counts is a big part of their fatigue, perhaps giving ITP treatment to raise the platelet count so that these activity restrictions can be lifted may improve the patient's fatigue. And again, some of the treatments that we use for ITP are anti-inflammatory, immunosuppressive medications, and these could be particularly effective in improving fatigue in patients where inflammation and sickness behavior are a major mechanism driving their fatigue. So this is my final slide with a return to the questions we asked and a reminder of our key answers. So first of all, what is fatigue? I'll remind you that medical fatigue is an extreme tiredness that is associated with an inability to function, and it generally occurs in the absence of an excessive energy expenditure. How is fatigue measured? Well, it's best measured using validated questionnaires, and I fear that it is probably not done nearly enough in clinical practice. And I think one of the areas that we as ITP practitioners could look to for quality improvement and for improving our patients' experiences to do a better and more rigorous job of assessing fatigue as a matter of routine in our ITP patients. How common is fatigue? It's very common in patients with ITP, and this is true in patients across the world and in children and adults. What is the mechanism of fatigue? Well, as we discussed, potential mechanisms are multiple. And in most patients, there's probably a multifactorial reasons for fatigue. Again, different mechanisms may be at play in different patients. And then finally, how can fatigue be treated? Well, there are many possible treatments available, both pharmacologic and non-pharmacologic treatments, but treatment should be individualized. And ideally, the treatment plan should be designed to match the particular mechanisms of fatigue in that individual patient. And so with that, I will conclude. I'd like to thank you very much for your attention. I hope that you didn't fall asleep during this lecture, but if you did, I hope it was because of your underlying fatigue and not because the lecturer was boring. Thank you again, and enjoy the rest of the meeting.